Hello and welcome everybody to another week with Dr. McDougall. I am Gustavo Tolosa. This is my mother Raquel, and today we are going to play a piece of music for you. Some of you didn't know that my mother is also a pianist, and today we have a four-hand piano piece by Wolfgang Amadeus Mozart. It's about 2.5 minutes, but I thought it would be fun for you to play while we wait for everybody else to log in. And of course, I chose Mozart because Mozart's music, there's a lot of research that says that it creates extra electricity and waves in the brain, and of course it can raise your IQ, and who cannot use some extra IQ nowadays? So that's why I chose Mozart, and this is a very short piece. It's the first movement of a piano sonata that he wrote, and I hope you enjoy it. And after this we will continue with our regular webinar with Dr. McDougall. Now I'm going to move the camera so that you all can see the keyboard, and I will put it on pause for a second. How are you, Dr. McDougall? Today we have a great webinar with a wonderful topic.
I'm good. I didn't get a chance to see what you did either, but I'll watch it later.
Okay.
Good. Well, good. We changed the topic of the webinar because of the newsletter that I put out first of this month.
Right.
It did what I've always tried to do, which is to get people's attention. I've said my whole career, I've said things like, I'd take off all my clothes and stick carrots in my ears if I could get people to listen to me. And so what I did is I took off almost all my clothes and put a picture in the newsletter, which was about Bobby Moore of Cardiologist. And I put a picture, as many of you have seen, a picture of me with a
Right. Yeah.
tattoo across my chest which says, "Do not cath, I will sue." Now, those of you who are wondering whether it's a real tattoo or not, you'll have to wait until the Kauai 2017 trip with us to Kauai before you know for sure whether it is or not.
That's a good incentive.
But I feel whether it is or not, I should tape that, or I should put that in my wallet, or tape it to my chest, or do something because it's just a really, really scary world out there. First of all, I want to appreciate all your kind comments and your well wishes for me. I've had a tough year, but fortunately I'm back, and I'll explain this to you, those of you who don't understand what went on. I'd also like to say, Jeff Novick always tells me how vicious, and other people say how vicious the internet is. And boy, I got some vicious comments. Somebody wrote me yesterday and said, you've been looking frail and you should walk the talk. And I said, well, I had a tough year, but I'm back. I feel well. I said, send me a picture of you half naked and your age, and I'll show it on today's webinar so you can give me an aspiration of what I should be like at almost 70 years old or 69 years old. Over the last 4 days, I spent 2 hours each day, and I'll do it again this afternoon, playing with my 3 grandkids in our pool. And I'm not at the shallow end. Grandpa's not at the shallow end. He's at the deep end. So I'm doing well. It was a great learning experience for me, and showed me that I'm not invincible. It happened back in March of 2016. We finished an advanced study weekend, and I would say I caught the flu. That's what happened, because I was that way sick for several weeks. But unfortunately, what happened is I lost complete muscle control. It's not like I fell or tripped and had some guard, but I lost complete muscle control, and I hit the floor like a free fall. And any of you who think that you wouldn't suffer injury, come to the clinic, come on over sometime. I'll inject you with succinylcholine, which we used to use to paralyze people. I don't know whether they do it now anymore before surgery. So you have no control of your muscles, no ability to protect yourself, and I will drop you on the floor from 4 feet, and let's just see what happens. Anyway, I did hit very hard, and what I believe happened, and did not get confirmed, is I got non-displaced fractures of my left thigh bone, non-displaced. So I could still walk on it, but with extreme pain. And I think I fractured a couple of vertebrae and broke part of my pelvis. Anyway, Mary was just terribly frightened. And of course, I was in horrible pain. And she asked me to take me to the hospital in an ambulance. And I said, don't. So just leave me here in bed and let's see how I do. It was a little more traumatic than I'm telling you. But I was afraid to go to the hospital. And that's why I shared this personal story with you, is that you should be afraid too about getting in the hospital environment. I was afraid of what could have happened to me with the well wishes of well-meaning doctors, but it's completely out of control what goes on. Before I continue this, just let me add a couple of other personal things to my story. Many of you gave me advice on taking supplements and taking vitamin D and all kinds of things. Hey, I appreciate it, but I know the science, I know the truth. I'm not invincible. I mean, I'll throw you out in front of a moving bus and let's see what happens to you. I don't care how well you eat. You drop a bowling ball on your foot, let's see what happens to you. Anyway, regardless, I was injured and in pretty bad shape for quite a while, but fortunately I'm fully recovered. Taught me also that I needed to call on my friends, and many of my good friends did help. I had a program scheduled 4 days later, which, by the way, I attended by Skype the first day to see the history and do the history and physicals with my good friend, Dr. Don Forrester. And Dr. Clapper, Dr. Michael Clapper came out and help with some lectures, but I did do some of the lectures myself. And I went in toward the end of the week and saw all the patients too. It wasn't easy, but I'm not one to complain. Nobody really knew, and no one can feel my pain. Just like I look at you, and we're starting a program tomorrow. We've got like 50 people coming, and I can't feel your pain, even though it's going on. So very few people knew of the ordeal. But anyway, I got through it. A couple of good things came out of it. One is my good friend, Dr. Gustavo Tosolo, got me involved in doing a yearly or a weekly internet. That was one outcome of, there's always a good thing out of tragedies. And the good thing is we started doing webinars, and that made it easier to reach more people. And it was just an extremely important turnaround in our message. And that came directly out of that. And the other thing that came directly out of that, even though I would be myself, always in the past, seen as many as 55 patients on my own, I realized that I'm not going to be able to do this forever. And so I hired Dr. Anthony Lim, who, those of you who have met him, you know what a great fortune I had in hiring Dr. Lim to come in and help me with patients. I still see all the patients. I will be there Friday, Saturday, and Sunday, all day long with Dr. Lim. He's really good, but there are a few things the old man still has to teach. So that's another really good thing that came out of this. And anyway, those were some of the good
Dr.
things.
McDougall, we will have Dr. Lim as a guest soon.
Oh, good.
Oh,
you'll appreciate what a great doctor and a gentleman he is. He's an amazing guy. He's added so much to the program.
Right. So people will be able to meet him.
Yeah, I like I say, I'm still fully active.
Very good.
I give about 7 lectures and see all 50 people we're seeing starting tomorrow. But anyway, that was the situation. But what inspired me to reveal myself was the fact that all the efforts I've been putting in for years and years, and the way to help people is I've basically been ignored. And then this article came out. It came out in JAMA Internal Medicine, and I'll just kind of show you the page in case you want to look it up. Hopefully not violate any copyright issues, but it's called Continued Use of Prophylactic Percutaneous Coronary Intervention in Patients with Stable Coronary Artery Disease Despite Evidence of No Benefit. Deja vu all over again. And what they talked about is that doctors have known, cardiologists, general doctors have known for, probably forever, because it's never been proved to be of benefit, that operating on chronic coronary artery disease does not save lives. At the end of this article I just showed you, it's an editorial, it says, the American College of Cardiology and the American Heart Association guidelines on perioperative cardiovascular evaluation of treatment of patients undergoing non-cardiac surgery, like hip replacement or maybe removing a breast cancer or colon cancer, whatever. The American Heart Association, the American College of Cardiology recommend that routine coronary revascularization, that means angioplasty, not be performed before non-cardiac surgery, exclusively to reduce perioperative cardiac events. The persistence of unnecessary and potentially harmful angioplastic procedures should stimulate efforts to enhance translation and dissemination of the clinical science and improve compliance with these guidelines. But doctors, even though it was announced in 2007 by the American College of Cardiology and the American Heart Association, this just reiterates this article that was in the March 28, 2016 JAMA Internal Medicine. These guidelines were put out in 2007. So it's almost 10 years ago. And then they do 2 follow-up studies in 2011 to show whether or not these guidelines telling cardiologists to stop doing these unnecessary procedures, whether they were followed. And both studies showed there was non-compliance. The doctors would not stop doing them. And they still have it. And this particular article was stimulated by a study that was published in that same journal, where they looked at nearly 2,000 people who were going through non-cardiac surgery. You know, fix a broken arm, take a colon cancer out, whatever. They looked at 2,000 patients who had non-cardiac surgery planned, and they found that half of them were told by their doctors that they had to have revascularization. They had to have angioplasty with stents put in before they went to the surgery. Now that's criminal behavior. Did I say that? Yes, cardiologists are acting criminally. And I've written articles about that in the past. This time I just said, beware of interventional cardiologists.
Beware.
You know, because you know I don't want to use any emotionally charged words. So, I mean, just think about it for a minute, ladies and gentlemen. If you or a loved one goes to the hospital and needs to have an operation, like for example on my tibia, it was a spiral fracture that was it was not broken to the point where it was unstable or anything, but believe me, I'm certain there were some breaks there, probably superficial. But a friend of mine, actually a very good friend of mine, he was ice skating last winter, and he did have a spiral fracture of his femur, and he did have to undergo anesthesia. And he did have to go to the hospital. He told me, he wrote me after he read this article, that this is a board certified gentleman that's my age who's been in the medical business for as long as I have. He told me he was frightened from the moment he arrived at the hospital, and he felt like he was out of control. And he fought every minute, every step of the way. And he said the only time that they had me without at least my input was when I was under anesthesia. And I was frightened to death of that. So when half of you who shouldn't be having cardiac intervention, according to the American College of Cardiology, the American Heart Association, are going to be told to have it, do you think that there's a problem? And I'll tell you one other thing, and I don't want to violate anybody's privacy, but a very, very good friend of mine, who I've known for almost 20 years, he last year was found to have colon cancer that needed treatment. He's 90 years old. And they wouldn't give him the treatment until they did a preoperative revascularization. In other words, they went in and put stents in. So they went in, you know, you think it's an innocuous procedure. They went in and they put 2 stents in. He had 2 massive heart attacks and 4 cardiac arrests right there on the table. They had to shock him 4 times to bring him back alive. He spent the next year in a convalescent home. He's still not right. He will never be able, as far as I can tell, ever be able to go back to it. This man was working at 90. He was perfectly fine. They could have gone in and just taken the colon cancer out, or they could have done, I mean, he's 90 years old, a diversion colostomy where you just take the bowel and just kind of put a bag on. No, it's not comfortable, but I mean, he has no normal life left. These things are really happening. And I've tried to warn people. The American College of Cardiology, the American Heart Association have tried to warn people, and doctors won't stop this behavior. Why? Because they make big bucks. You know, an angioplasty's worth to the hospital and to the doctors is worth about $60,000. They just won't stop it because of the money. They're crooks. They're absolute crooks. Now, if you look at my newsletter and my discussion board, there were a few physicians, and I know you're loyal physicians and you're good physicians and so well-meaning and whatever. And I hate to offend you, but I'm gonna. You told me, at least in one of the statements in there, you told me that I was a turncoat to my profession. For me to take my fellow colleagues and to criticize them was wrong behavior. Look at the discussion board. Excuse me, I never took an oath to protect the financial interests of the medical business. I took an oath to care for my patients and to protect them. And so did that doctor and the other doctors that wrote on the discussion board. You should be ashamed of yourselves. Now, I know why you do it. I know why you're acting cowardly and you're not standing up for your patients, because you're frightened. You're frightened of what your colleagues will say. You're frightened of a reputation. You're maybe even frightened of losing your job at Kaiser or some medical group if you stand up. I know why you're acting cowardly. I understand. I don't have to do that because I'm self-employed and I'm just one SOB, and you know that. So I can say what I believe. Otherwise, you know what you ought to be doing? You doctors out there who are my friends and believe in me, and I don't care if you hate me after this, and you go eat a great big double Whopper steak burger. I don't really care. You know what you ought to be doing? You ought to be protecting your patients. You ought to be stopping the mastectomies that have been proved to do horrible mutilation to women with no survivable benefit, even before I got into this 35 years ago. You should make sure your hospital, your surgeons do no mastectomies unless there's not an alternative. Sometimes it's necessary. But I would guess 95% of them aren't. Likewise, these routine radiotherapies after breast cancer. Don't do it. 2 articles came out this week in JAMA Internal Medicine about treating ductal carcinoma in situ. And they say that's kind of a precancerous condition where a woman loses her breasts, gets hormones, chemotherapy, radiation. And they said don't do it. Well, I've been telling people not to do it for 35 years. Why aren't you standing up and protecting your patients? Is my question to you. Why are you acting cowardly? I understand you've got to survive. You got to put shoes on the kids. You know, I'm just glad I don't have that restraint. But don't you tell me that I'm acting wrongly by hurting the business of my colleagues. All right. Just wanted to say that to remind you how I really feel. Your chest. Well, you know what? I get this like when I there's a very nice, about my age, gastroenterologist that came to many of our advanced study weekends, probably will in the future, wanted to or did come up on our venture trips. And he agreed with everything I said about, these horrible mutilating mastectomies and cardiac surgery. But then when I picked on using colonoscopes, doing colonoscopies, that they did more harm than good. Boy, he got so mad at me, and he wrote me a letter, and I put the letter, by the way, it's in my archives. And I was right about everything else, but now when I was picking on the way he was making $2,000 a procedure, no, sir. Of course, you know that the Canadian Task Force on Preventive Medicine has come out and told the people in Canada to not get these colonoscopies in terms of screening. Well, anyway, let me just discuss a couple other things, and maybe people will have some questions. What I tried to tell you, of course, you even saw my picture, how lopsided I am. I really did have a stroke. I think there are people who said he didn't have a stroke at 18. Excuse me, look at this picture. Yeah, anyway, I know I had atherosclerosis. The way I ate, which was not atypical of the way people eat, just happened to be I had a ruptured plaque and a stroke. Well, the scientific literature, and this goes back into the 70s and 80s, shows how often, and I put it in the newsletter, how often you are likely to be found to have artery disease worthy of a surgeon's attention based on your cholesterol. One of the charts says that for men under 40, the chance of them having a closure of 50% or greater, you're really not supposed to do these angioplasties or bypass surgery unless it's 70%, but some doctors do them, just to be on the careful side. 50% or greater, which your chance of having these plaques found, if you're under 40 as a man, if your cholesterol is under 200, it's 20% of you. If your cholesterol is 250, it's 60%. If your cholesterol was like mine, which was 338, it's 91%. And then I gave you these charts. You had the references. The scientific data has been there for 30 years. There's no other new information that says this isn't true. Based on your age, the chance of finding moderate to severe coronary artery disease based on age. If somebody looks, if you're 28, it's 22%. If you're my age, which is 70, it's 91%. Yeah, what I'm telling you, ladies and gentlemen, if they look, they will find and they will treat. And you must have your guard up. You must treat these people in the hospital business, these doctors, like you would a used car salesman. They're out to get you. That's what their business is. Now, I'm not trying to say, I guess I am.
Yeah, go ahead.
I guess I really am. They're not being honest.
Right.
If they look at the data, and I showed you the studies there, you can read them. You can read the Courage study. You can read the 15-year results. You could read the study that was just published a couple of weeks ago about successfully opening arteries and no improvement in life. There, I can show you 28 studies. You can't show me a one that says other than that these procedures do not save lives, and in many cases, they increase the risk of problems. And they're not cheap. And in bad hands, 2% of people die from these procedures. There are about a 7% complication rate, bleeding and so on from going through this angioplasty. This is not like taking a sliver out of your finger. So you know better. You know better. Maybe you can get up in the morning and look yourself in the mirror. Maybe you can find some justification. You can run some words through your head and maybe speak to the nurses or whatever your connection is and justify what you're doing. But the science says you shouldn't be.
Well, there are lives in stakes, Dr. McDougall, when you say that you understand people, doctors, why they do this, and they have to send kids to school and all that, but still there are lives here. Well,
they don't want to be criticized. They don't want to lose their jobs. That's a big thing, even though they know the truth. Anyway, yes. but there are cases, and I explained that very clearly in the newsletter, where these interventions do save lives, and that's where
like within
within 90 minutes.
Right.
90 minutes, you can get in and dissolve the blood clot. Maybe I can just take a minute. Let's see if this works out and show you a couple of things. And then if you can kind of look over and gather a couple of questions. Let me see if I can get a slideshow going.
Sure. I do have questions that people have submitted. While you do that, I'll let people know that the email to send questions to is webinar@drmcdougall.com. Webinar singular, not webinars with an S at the end. That's where you can send questions for me too.
Well, let's see. Do you have a blank slide up?
I do. So now we're ready.
All right. So, this disease, atherosclerosis, it goes throughout the entire body. Now, it's not just the heart that gets these sores that rupture, but it's all over the body. And then what happens, I'll go through the process for you in a minute. But if you close the arteries to the eyes, you get macular degeneration. You close the arteries to the ears, and you get hearing loss, tinnitus, and vertigo. Close it to the brain, you get a stroke, like I had. Heart, you close the heart artery, you get a heart attack. You close the artery to the big artery in the body called the aorta, and you get aortic aneurysms, which is I refer to as John Ritter's disease. He died of a ruptured aneurysm or dissecting aneurysm. You close the arteries to the kidneys, you get kidney failure. You close the arteries to the bowels, you get bowel infarcts. You close the arteries to the backbones and the discs between them, you get degenerative disc disease. That's how these discs become weakened. You just take a step and they break because they have poor circulation. You close the arteries to the legs and you can't walk. That's claudication. If they get closed really bad, the feet die. That's gangrene. And you close the arteries to your penis and you get to be impotent. That's why men mostly become impotent, is because artery disease to their penis and the nerves that control an erection. All right, so here you should see a picture right there of an artery, and you see there's a one cell intima layer, just one cell thick. That layer gets damaged by eating bad food. I mean, people talk about oxidized cholesterol, products of cigarette smoke, combustion, antibodies that are produced by drinking milk, whatever. The intima gets injured. As a result of injury, what happens is as the sore develops. It's just like if you stuck a sliver of wood under your skin, you'd get inflammation and swelling, and then pustule material, pus cells, would go in there, and you'd form a sore. So you've got this sore inside your arteries, and the sore gets worse, and there's a cap over the sore. It's called a fibrous cap, which kind of contains everything. But you've got this pustule inside your artery, and then what happens is some of these pustules, you've got 44,000 miles of disease going on. some of these pustules, they break, and you see there the break at the bottom line, bottom artery. And this pustular material comes roaring out of this breaking pustule, like a pimple popping on a teenager's face. And because of this release of material and the formation of products of injury, a blood clot forms. And this blood clot is, excuse me, listed there as a thrombus. And let's see. Let's go on to the next slide here. So here's a picture I put in a book that I published in 1996. We've known about this forever. It used to be when I was in active hospital business, we would call a heart attack a coronary artery thrombosis because they're blood clots. So you got these tiny sores that pop and form a blood clot. Now I'm going to show you, hopefully this will come across, let me know if it does not. I'm going to show you a very impressive video that you can find on the internet.
We can see the video. There is no sound to the video, but we can see the video.
Okay, so you understand. Can you hear me okay, Gustavo?
We can see the video, but there was no sound.
Oh, that's too bad. That's too bad. Well, what she was showing you there is that these pimples form and then they rupture and then a blood clot forms. You saw that part?
Yes, yes.
Okay, so what happens is this. You get these pimples breaking, and just like if you cut yourself, a blood clot forms, and this blood clot is usually not totally closing the whole lumen of the artery, but it just blood clot forms over the top of that ruptured pimple. And then what happens is fibroblasts cells come in, healing cells. They come into the blood clot and they replace it with scar tissue. Now you've got scar tissue on part of your artery, on your part of your artery wall. And here you have a picture of an angiogram, and you can see the arrows pointing to shadows.
Right.
Those shadows are scars that result from blood clots, from these pustules that popped maybe 10 years ago or 15 years ago, and a blood clot formed over the top, and then the blood clot was replaced by scar tissue. So you get a one-layer blood clot, or scar, one-layer scar, and then maybe a few months later, another blood clot ruptures, or another pimple ruptures, and you get another blood clot over the top of that, and then the fibroblasts come in and they replace the blood clot with scar tissue. Now you got a two-layer scar, and this continues over and over again as you get these ruptures, blood clots, and the scars form, and it closes the arteries. You have to close the artery by 70% before you get any symptoms. Now, what the doctors see when they do angiogram is they see these old, fibrous, non-lethal, stable plaques. All right? Now, as I said, if you get a blood clot that forms and you can get from the initial heart attack, you know, the initial chest pain, if they can get you to the cath lab, they can put a catheter in there and they can open up that area and probably save lives. But after 90 minutes of that blood clot being there, say after 6 hours, our heart muscle is already dead. You're dealing with dead heart muscle, and then, you know, probably 3-4 weeks later, you're dealing with just scar. But this is what the doctors are operating on, are old scars. You put this kind of x-ray up in front of a patient, it scares them to death. In fact, we have a name for this. It's called the Widowmaker. And let me give you a side note. Write this down. There is a documentary called The Widowmaker. It's put out, I think, by the CT scan people. I think they paid for it. But it's an unbelievably impressive documentary. You can get it on Netflix called Widowmaker. Watch it. It talks nothing about diet, so it's useless from that point of view. But it tells you about the criminal behavior that's going on in the heart business. It's a beautifully done video. All right, so this is what they scare you with. They show you these blockages. They say, you're going to die if you don't get these fixed. These are old scars, ladies and gentlemen. You'll die from new pimples that pop. And the way you stop the new pimples from popping is you stop them from forming. And the way you stop them from forming is you stop eating the garbage American diet, the meat, the eggs, the dairy, the vegetable oils, and so on. But you're going to be left with the old scars. And this troubled a lot of you. A lot of you think that these old scars go away. They don't. The swelling in the area that's still active, that will reverse. And so you can see reversal of artery disease, but the actual scar material doesn't go away. It's just like when you were a little kid and you fell off your bike on your head, you got a scar, and that scar is still there 50 years later. It's not going to go away. If you fell on your head again, that scar is no more likely to break open than the area next to it that doesn't have a scar. This is old, healed diseases of no importance unless a heart surgeon finds it or a cardiologist. And then it becomes a really important disease. So,
and they will find it.
Well, if there's an article I quote someplace in the paper about angioplasty and fun,
right?
Money and fun. In articles I've read in medical letters and so on, it's been stated that the reason to have your heart arteries looked at is if you have health insurance and you have a heart. So really, that's the way the business goes. So all of you out there, pretty much all of you, you have heart artery problems.
Right.
Okay. Anyway, so this is what they do: is they go in and they catheterize. Catheterize you.
Would you say that some of the inflammation comes from eating all types of oil?
Yeah, well, vegetable oil. All right.
Besides everything else,
particularly margarines, they're very toxic. These omega-6 fats, they cause terrible damage to the arteries. But we can get into that some other time. So they put a balloon in there, a catheter. They expand the balloon and they break open the plaque, this old scar tissue now. And when you do that, what happens is you release products of injury. As a result, half the arteries so treated are completely closed down within 5 months. So what doctors have done since then is, this happened about 20 years ago, is they put these stents in. And they put these, they break open the plaque with a regular balloon. And then they take another catheter and stick it in your usually groin. And they have this metal mesh, which they blow up and prop the artery open. And that has reduced the risk of blood clot closure. But the problem is these bare metal stents, they're a foreign body, and the artery reacts, and smooth muscle cells proliferate and cover up the bare metal. So 40% of the arteries so treated at the end of the year are completely closed up by this cell proliferation. So now what we do is we put cancer drugs in these stents. They're called drug-eluting stents, and they help stop the cell proliferation. But after about 3 months, the drugs are all eluted out of the stents, and now they're bare metal stents, and they have a high rate of sudden death after these have been put in. Anyways, it's just not a great thing. It doesn't save lives. That's what you need to know. It relieves symptoms, but it does not save lives. There's absolutely no inconsistency with that, and every well-read, informed doctor knows that, and all patients should too. Now, if you have symptoms like chest pain, you may want to have one of these done. I mean, chronic chest pain, chronic angina, you may want to have it done. It works well for that. But don't let them fool you that this is going to save your life, because it's not, unless you get there within 90 minutes, as I explained. All right, there's the OAT study. This is one of the basic studies that caused the American College of Cardiology and the American Heart Association to tell doctors to stop doing this. They found no benefit in terms of death, reinfarction, or heart failure. In fact, those who got the cath and the stents had an excess of reinfarction 4 years later. And then we have the COURAGE study, which again put a coffin nail in the cardiac business. And that's what caused both of those heart associations say, hey, ladies and gentlemen, stop it. Here's one of the articles, the impact of national clinical guideline recommendations for revascularization of persistently occluded infarct-related arteries on the clinical practice in the United States. In other words, they're asking, what happened when the American College of Cardiology and the American Heart Association told doctors to stop doing this? What happened? Nothing. There was no change. No change. They won't stop it. They won't stop. Even this article told you March 2016 in JAMA Internal Medicine. These doctors won't stop doing it. You got a heart, you got insurance, they got a catheter.
You're a candidate.
Yeah, I'm heart. So here they say in this article there are two implications. First, patients with stable coronary artery disease, they continue to have costly and ineffective procedures. And the second statement is the guidelines just mean they won't listen. Well, why bother doing the studies and producing guidelines? Because these people will not stop. And this quote I put in the newsletter for you. In addition, a fee-for-service health system in an environment in which more and more physicians are being compensated on the basis of relative value unit productivity, it remains to be determined whether personal financial gain might play a role in continuing old practices and in performing procedures shown to be of no benefit. Now, what do you call this? What comes to your mind when people do things that take your money and hurt you? Ugh.
It's a crime. Yeah.
Look, modern medicine does a great job with acute illnesses. Like if I'd have had a displaced spiral fracture of my femur, you bet I would have been in the hospital and asked for them to set it, straighten it out, and it may have required some type of metal implant, surgical implant to fix me. You bet I want to be there. If I get in a car accident, end up in the ICU with fractures and wounds and so on that need medical treatment, don't come in and give me a bowl of mashed potatoes and carrots. I want the surgery, I want the drugs, I want the painkillers, because medicine's great at acute problems, like that sudden rupture that you get to the operating room in 90 minutes for. But when it comes to chronic disease, we do far, far more harm than good. I mean, that's just the way it is. And telling the truth just doesn't seem to help. But it may. I mean, if enough people know, we had 140,000 likes on our Facebook over that particular article. I'm amazed at how many of you out there are so intuitive and smart that you can diagnose me and give me advice. I mean, I can't even do that. I've been in medicine for 50 years. And I did object to a couple of things. I did object to a few of the references in these discussion board and on Facebook that called me a liar. I'm not a liar. I tell the truth. It's not that I'm never wrong, but I don't lie.
Right.
And anyway, that's probably the only thing I objected to. I really appreciated the well wishes everybody had. I plan to continue the fight. And also, some of you were upset with me when I told you that I personally, about 25 years ago, just out of curiosity, I had a CT scan of my heart. And I have significant scars in my arteries. But that was, at 18 years old, I had a massive stroke. You think, and at my cholesterol level, I had a 91% chance of having artery disease. You don't think I have this? I have old scars that have calcium in them, but I have no active disease. I mean, this afternoon, I'll swim for 2 hours in the deep end with my 3 grandsons without any chest pain, without any limitation. They're old scars. Leave them alone. If I was generous enough to donate my body to a medical school so the medical students could learn, they'd cut into my heart arteries and they'd probably see pretty wide open heart arteries. But if they look closely enough under a microscope, they'd see old scars. Before I was age 27, when I used to eat the same garbage the usual American eats. I've got I'm not a perfect human specimen, but I've fixed what is fixable.
Right.
And I hope to get a few more years out of this. And
Yes.
I'm still having a good time.
Well, Dr. McDougall, like you mentioned with your friend who's 90 years old, when a person goes to the hospital, do we have any saying when a doctor says that we need an angioplasty or we need some other?
Well,
or not, no, or we're just stuck there.
Some of the patients, some of the people who wrote me on the newsletter said they were in the exact situation. They wrote on the discussion board, the exact situation where they came in for a non-cardiac problem. The cardiologist said, you have to have this done.
You have to have it.
Yes. Oh, yeah, they decline. I explained to you in this study, of the people who had non-cardiac surgery, half of them were told to have their arteries treated before they got the surgery done.
Right.
So do you have a choice? I mean, you're going to be told at least half the time that you have to have your arteries studied before they'll fix your ankle. So do you have any choice? Yes, you have a choice. You get a tattoo put on your chest like I did. Mm-hmm. Do not cath. Somebody said they were going to put a do not resuscitate on their chest. You have very little choice. I can tell you, even as brutal as I can be and stubborn as I can be and as knowledgeable as I am about this business, we came back from Peru about 15 years ago on one of our adventure trips, and Mary contracted non-celiac sprue, which is not worth going into it. Anyway, my family always wants me to be the doctor. That's too much responsibility for me, and so it took a while before Mary got better. It takes a while to get over non-celiac sprue. And I said, I'm going to take you to the best gastroenterologist in the Bay Area, and we're going to get another opinion. I refuse to be responsible for what's going on with you. And so we went in. The doctor examined her and checked her over and ordered some tests. And then he called me in and he told me, he says, I agree with you. She has non-celiac sprue and you'll get over it. And then he started the sales pitch. He said, you guys, Mary's in her 50s. She needs to have a colonoscopy. I said, well, thank you very much for the advice and we appreciate your opinion and so on. And I started to get up and leave. He said, wait a minute, sit down. You're being irresponsible. You must have this colonoscopy. She's 55 or 50 years old. This is absolutely necessary. And I looked at him and I said, excuse me, sir. I said, I know more about this business than you do. We came in here for an opinion for why she still had stomach troubles after a trip to Peru. And you're trying to sell us a $2,000 colonoscopy. I said, as well-informed and as strong as I am, I'm able to tell you that you are full of garbage. And I said, but I feel so sorry for the other patients who don't have the knowledge I have and the combativeness that I have and who believe in these doctors, who believe in them. I said, I told the doctor right to his face, I feel so sorry for your patients. And I've been in other situations where I've actually threatened to report physicians who mistreated my patients to their medical board. You read about, anyway, we'll go over that some other day. But I don't hesitate. I don't hesitate to protect my family, myself if I'm conscious, and my patients when they get into this situation. Sometimes they don't ask me until it's all over. And
right.
Like this gentleman who's 90 years old, he and his wife, their lives are very damaged. But if they would have called me as they did before,
right?
He had when they found the cancer. If they'd have called me before, the doctors insisted they have his heart artery studied. I'd have been they're very good friends, and that's all I'll say. Yeah. I would have contested with the doctors and told them to leave them alone. So, but few of you are in the situation that I am, knowing what's going on. But be informed, as I say, act like you're dealing with a used car salesman, man or woman. These people are in the business to do things to you. It's called an operating room theater. Why do you think they call it an operating room theater?
It's a show, right?
It's a show.
It's showtime.
No, don't misunderstand me. I mean, I know some of you, especially you in the medical business, you're furious with me. How would I ever talk this way? Why am I being so brash. Yeah, well,
Well, you've been around for 44 years in the medical profession.
yeah, 50, actually 50
50.
or 48. Well, you know what? Somebody's got to stand up and say it. The medical journals say it. You know, the research is all consistent, but all of that's forgotten when it comes to taking care of you. And again, if a doctor like you came in, and sometimes people do die after hip surgery and so on, the doctor's afraid that the lawyer will come and say, why didn't you do preoperative revascularization on the patient? He had a heart attack after the hip surgery. We're going to sue you. I mean, even though all the research says this is criminal behavior to do it, and the American Heart Association, et cetera, tell you not to do this. I mean, it's much easier. It's much easier in the medical business to have the patient die with a bag full of drugs next to his or her bed, and having gone through 4 or 5 surgical procedures, even though the drugs and the surgery kill them, the doctor's much safer. You know, if the family comes in and says, well, why didn't you do this? Why didn't you do it? I did everything. Look at the bill. I spent $200,000 on your grandpa who's 90 years old. How can you sue me? You know,
Right, exactly.
That's one of the big problems. And don't take it personally. It's just the way it is.
Just the way it is. Dr. McDougall, can you take maybe a couple of questions?
Yeah, let's do that.
I've combined a few questions that came up several times. One says that, what about a person that has atrial fibrillation and his heart has been shocked twice now? Can a whole food, plant-based diet heal the damage and help with the arrhythmia or not?
No, it is caused, atrial fib is caused by the Western diet, and the cause is damage to the micro, tiny vascular system. But what happens is the tiny blood vessels get damaged, the nervous system is disrupted in the heart. You go into atrial fibrillation. Cardioversion is almost always a failure. Very seldom do people stay in normal sinus rhythm. And that's why it's recommended as general practice of medicine to not cardiovert people. Instead, if necessary, control the rate of their atrial fibrillation, but not trying to put them back into normal sinus rhythm. So no, it can't be fixed by any means. There's ablation procedures that I'm not going to talk about because I don't know enough about, but they have certainly been done a lot, and I've heard patients talk about great success. But you know, I got a lot now, know a lot more about things before I give an opinion. I don't know enough about ablation to say anything, but it's very popular surgery. There's also the whole deal about whether you should take blood thinning medications like Coumadin and anyway, there are a whole bunch of new ones out there.
Okay, so basically they would need to go under some kind of treatment.
Well, there really isn't much. There's no treatment for most patients. Most patients in good health should have no treatment, but almost all patients, even in good health, this is almost all patients are put on blood thinners. These days, these blood thinning medications like Exaltol and there are a whole bunch of new ones out. Really pricey. They're like thousands of dollars a year. We used to use Coumadin, and I can't say that's not of some benefit, but there's a far less benefit and far more harm than is advertised. There are some scoring systems like the CHADS system, CHADS, that you can look up, which helps determine benefits versus risks and whether or not you should go to these powerful blood thinning agents. But you got the problem from eating the Western diet. Taking blood thinning medications has some significant benefits. It's universally recommended, but mostly, I mean, you got to be a sicker person to have the advantages outweigh the harms. And it gets a little complicated, but at least it'll get you started thinking about what to do. And people do well with AFib. You do 20, 30 years, no problems at all.
Okay, all right. What about having to have a mitral valve repair or replacement? Someone says that their cardiologist says that they have to have an angiogram before the repair can take place.
Well, that's what they do. That's what the business does. And by the way, valve surgery is a miracle surgery. It really is one of those modern medical miracles, not without risk. And they have new ways of putting valves in. My old hospital just sent me an advertisement. They're starting to do it now, where they go through an artery, I think in the leg. I have to learn more about the procedure. Instead of cracking your chest open and putting you on the heart-lung machine, which we talked about several weeks ago, they have a way of now threading a valve up into the aorta. I don't know, maybe other valves. And so again, technology has some wonderful things. You just have to be careful that you're not being overtreated. And when it comes to the interventional cardiology business, I'll guess 70 to 90% of the procedures, more than that, with chronic coronary artery disease are done unnecessarily. And the criminals will not be brought to justice. Nobody will stop it. 80% of the income of your hospital, 80% comes from heart disease. These cath labs are the biggest generators to keep the doors of the hospitals open.
Right.
They're not going to stop this. Think about it in your town. The newest, biggest buildings are hospitals or heart surgery centers or cancer centers.
They are. Yeah.
This is the only growing segment of the U.S. economy, is the hospital medical business. And we're growing it by borrowing money from China. Yeah. Anyway.
Incredible. Yes, it's the sick business, it's not the health business.
Again, let me repeat myself, because I know some of you are very upset with me now. Modern medicine has some wonderful things that I would take advantage of, have taken advantage of, and so on. But there are also things like mutilating women with mastectomies that are unnecessary, giving radiation that's unnecessary, giving chemotherapy, the chemotherapy business. Maybe I would never live long enough, but 50 or 100 years from now, if we still have a civilization and have a planet, if people look back and look at what has been done to people in the last 40 years in terms of well-meaning treatment, they will consider what has been done to people in terms of surgeries and chemotherapies and radiations to be one of the biggest crimes of humanity that has ever occurred.
Yeah, exactly. It's a mutually.
They'll laugh at it. We laugh at leeches, but I will tell you, that isn't even a close analogy.
That's not.
They will look back and they'll say, how could human beings treat other human beings that way? And then they'll say, well, let's see, the drug companies are the #1 money-making businesses in the world. And, it's just money, ladies. It's not a conspiracy. It's just money.
And we just have to be careful.
So what you have to do is stay well.
You wear
your safety belt. You don't smoke cigarettes, which is something, unfortunately, I did when I was a young man. You eat good food. You don't get food poisoned. You don't walk down dark streets in bad neighborhoods in the middle of the night. There are things you can do to prevent a lot of tragedies. Not everything. You buy safe cars rather than little tiny cars. You buy cars that have high safety ratings. But there are so many things you can do to stay well. I would say 80% of the disease people suffer from in this country and other Western countries is from their fork and spoon.
Right. It's the lethal weapons, like someone said once about the fork and knife. You were talking earlier about the Widowmaker, and I just happened the other day. There's a book about it. It's a very interesting.
Is it from the documentary?
Yeah.
Oh, well, again, you'll watch this, and I encourage all of you to rent it from Netflix or wherever it is. The Widowmaker. You'll be glued to the screen.
Yes.
Because they go to the top heart doctors in the world, and they ask them, do these procedures save lives? And they all say no. And they don't say anything about how to fix it with the food. That was the only thing disappointing about it.
Right.
And I think, as I say, I think it was a documentary in that book that was produced by people tied to the heart scan business. Which, by the way, I don't recommend you get a heart scan done. That's equivalent to 3,000 chest X-rays, unless necessary. I mean, there may be reasons to do it, but don't do what I did, which is just out of curiosity, want to see what your heart arteries look like. Because what will happen is you'll find them to be clear, and you'll say, "See, I can go back to McDonald's and get a double cheeseburger," or you'll find them to be calcified, and you'll go, "Well, where's the nearest cardiologist? I need to be cathed."
Right.
So a lot of information can be very dangerous. Unless there's a reason to look, don't look. I mean, if there's a reason to investigate, to get tests, if it's going to change decisions, then do it. But if there's not, don't. Get on with your life. Enjoy your kids and your grandkids and your friends and your work, and be reassured the human body is tough. Don't go poking around looking for things. That's why, PSA tests is just like, everybody knows that getting PSA tests is wrong, and it does terrible damage to men, except for urologists. They don't know that. I can't. It's just, I've heard stories, the U.S. Preventive Task Force, the Cochrane Collaboration, the Canadian Preventive Task Force, all tell you don't get PSA tests. But somebody was telling me that, an operating room nurse, that after one of the recommendations came out to not get PSA tests for prostate cancer, she was in an operation with a group of urologists, and they were sitting there talking about why this was wrong and why we are still doing good. And after the U.S. Preventive Task Force came out with their last recommendation, let's just say 4 years ago, saying this is a horrible procedure causing horrible harm, there was a group of urologists in New York who put out an infomercial that they played all over the East Coast, telling how important it was for men to go, hey, they're fighting back. They're not going to take this laying down. Same thing with mammographies. They're fighting back. They're wrong. They're doing horrible harm to people. The data's there, but they're not going to let the business suffer. Plain and simple, right or wrong, lose your breast, mutilate your wife. That's just business.
It is business. Dr. McDougall, everybody has enjoyed this webinar by looking at the comments so much, and we appreciate it, and really looking forward to next week's webinar with you again.
Yeah, what we're going to do is, who knows what we're going to do? Who knows what's going to happen between now and then? I just want you to know I am not invincible, but I do try and take good care of myself. I'm fully active. I plan on practicing at least 10 more years. As I've said to you before, when Mary and I, once in a while, because of our age, Mary's 70, I'm 69, we say, well, most people are retired at 65. Why don't we retire? And then we look at each other and we go, what would we do? We'll be running this 10-day program next week, and we'll be busy all week long seeing patients and having fun. Right. We're getting ready for the advanced study weekend. I told you I'd tell you about the amazing things that are going to happen at this September 16th through 18th advanced study weekend. It's going to be unique and one of the most amazing. And Mary has, we sold out for Kauai, by the way, except for the fact that she ordered 10 more rooms, and then she sold those out. And now she thinks she can get 10 more rooms.
That's great.
Yeah, so
wow.
we sold out twice for it, but we've been able to get more rooms for the Kauai, I think it's January 2017 trip. So if you want to go, and I will take my shirt off for you, and I'll show you my tattoo, and you can just say, that's pretty impressive,
That's right. And people can sign up for this right from your website.
Oh, yeah, they can. But when we go to Alaska in about 3 weeks, I'm not taking my shirt off. But if you ask if you could have a peek, I'll let you peek. Okay. If I do not cath, I will sue tattoo. For those of you going next week, Alaska's been sold out for a year and a half.
Right. Yeah. Wow. It's beautiful.
We're going to take the grandkids to show them what the world was once like, and is rapidly vanishing, because my grandkids will not be able to take their children and grandchildren to Alaska to see the glaciers.
No.
And the major controllable thing that we can do is to change the food to stop this. So
Yeah, it's major.
I'm going to mention that to the adults on the trip, but I'm not going to mention that to my 3 grandkids. I can't give them kind of a thought about what their future is going to be like, because people act so selfishly and so irrationally. It's just the nature of ourselves that we'd allow planet Earth to be destroyed so that my kids and grandkids don't get to see what you and your 2 children have.
Right. Right.
It's gonna be going. But anyway, we're going to see Alaska in about 3 weeks and have a whole bunch of great people with us. Hope we see you in Kauai.
Right. Right. Very good. Yeah. So we hope that we will be able to see your chest then.
Yeah. Yeah. Right. Mary said, I said, Mary, you're not going to get naked for the webinar. I said, no matter how impressed I am of the way you look. Well, she said, well, I could kind of wear a halter top bathing suit and show people. I said, no, you're not going to do that. We're only going to go so far with this webinar.
Well, who knows? Maybe if people were willing to maybe pay $10,000, I don't know, right?
Well, maybe we probably have to put it on a different channel.
Right.
I have no doubt with these 69-year-old eyes, what I see is just as gorgeous as what I saw 45 years ago.
Well, thank you again, Dr. McDougall. We all appreciate this time that you give so freely to all of us. And
my pleasure. Spread the word. Tell other people. You gotta. There's another way of looking at things, and
yes,
at least give it a listen and read the science.
Right.
And the science is absolutely consistent.
Clear and consistent. Yes.
Send me one paper that shows ME angioplasty saves lives in chronic coronary artery disease. One paper.
Just one.
Just
all
one.
right.
I'll show you 29 that says it doesn't.
The opposite.
You showed me one cardiologist, interventional cardiologist, any place that you know of who has been responsible in taking care of people with chronic coronary artery disease based on the recommendation. Show me one. I'll show you a broke cardiologist. All right, Tom.
All right.
It was fun.
Well, you all have a great day. We'll see you next week.